Yes, my name is Marguerite Alvarez, and I'm the CEO of Coastal Home Care Services, DBA Choice Home Health Care in Monterey, California. And we are a Medicare certified state licensed agency providing skilled nursing care, therapies, and medical social work in the home for people that qualify as homebound status with doctor's orders. We also have community caregivers where we provide private duty caregiver care, private pay insurance, and long-term care insurance. We've won the CMS Home Care Elite Award twice in our county, and we're the only ones that have ever done that. Well, home care, actually, I started in the business not as a nurse, actually, as a business, and I knew just from looking at the background, I'd had a degree in political science from UC Davis and almost finished my master's communications at University of Nevada, so I really didn't have a background in anything related to nursing. But I knew that with the baby boomers growing in that direction, that this was the type of business that was going to be going on for a long time. We have a lot of paperwork. Nurses in our business have at least 50% of what they do is paperwork, which is a negative. But the positive side of home care for the nurses is that they get to go out, and they really are the liaison between the nurse and the doctor. I mean, most people leave the hospital or facility, they might not see a doctor for another 6 or 8 weeks or 2 months. And basically, we're right. If the doctor gives the order for home care, there's skilled nursing needs like wound care, dementia issue. We can go over there, try to qualify them for Medicare, Medi-Cal, and basically be a liaison for those 6 or 8 weeks, or 2 or 3 months if we can research them. And we can keep the doctor informed of what's going on. If we see a problem, we can attack it immediately so that they don't have recidivism back to the hospital. So a typical day may start with the nurse knowing where she's going to do, say, 5 visits. And then all of a sudden we say we have an opening for her. So she's got to take 2 of those visits and reschedule them for maybe the next day. So there's got to be a lot of flexibility in her thinking. As I said, they've got to think on their feet. They've got to chew gum and bubble gum and skate at the same time. If people are looking towards a home care career, which they should be, even though a lot of it is paperwork, I will say that right up front, 50% of what their time is doing paperwork. The reality is they're taking care of the patient. And what they want to do is they want to go to a school that really has a separate home care program because the skills are very, very, very different. I mean, and also one other thing that nurses should realize is to get into home care now, they do have to have at least a year of acute care experience. So they can't just come out of school and get into home care. And that again shows you that basically people are realizing that nurses need more experience to be in home care. The type of skills you need in home care, which are observation skills. If you're working in a hospital, you go in, you take a blood pressure, you change an IV, you might recognize something going on with the patient, but you're really not paying that much attention to what's happening other than your direct job at that point in time. In home care, we really have to be very observant. We have to be working independently. We have to be very observant about the family situation. We oftentimes have to call in a psych nurse or a medical social worker to know how to handle oncology, to recognize, schizophrenia, to see, COPD patients and what to do with diabetics and things like that. Now our nurses have to have oncology background, they have to have psych background, they have to have an understanding of case management, they have to do medication checks, they have to check in with the doctors on a regular basis, they have to know emergency situations, and the most importantly is they have to be independent, they have to work independently, really, even though they have a team behind them and doctors to contact. Oftentimes the doctors don't respond in a timely manner, and that nurse really has to be the person that has great observation skills. They have to be able to recognize that even if the patient is sitting up and saying when they're being asked if they had pain, that, and this is an issue that comes up in one of the home health compare questions, is, what is your pain ratio and how much pain do you have before you started care and after? And oftentimes the person will have taken a pain pill right before we got there. So the nurse says to them, the question is, how is your pain level today? Oh, it's 2, but actually 15 minutes before it was 10. So she's got to start thinking in different ways about how to ask those questions to really get at the heart of what's going on with that patient. And that's something else we're all learning today too. Time management is extremely important, and if you're not a good time manager, you're not going to make it in this field. I wish that they would teach more home care skills. Right now, they still focus on hospitals and facilities, and home care dealing with patients in home care is so different. As I said, in a hospital, you may see the patient at the worst. When they get home, they want to get dressed, they want to take a shower, they want to be ready for the nurse that comes in, and yet they're really not doing that well. So we have to really, again, be observant and recognize that that patient may not be doing as well as they are. Or they may be doing really well and it's time to discharge them. So the bottom line is we deal with emotional issues, psychosocial issues, family issues, and we deal with the patient and their physical and mental state. Because right now it's not just a matter of going out with the doctor's plan of care that says this person had a hip replacement. We get out to the home and we may see a number of other things. We may see that they have 3 flights of steps to get up to their bedroom, and they absolutely want to use their bedroom. We may see that they have medications in their closet that are months and months, years and years expired, and we have to contact all the doctors and try to coordinate that. We may see that there's a family member that resents us. I would say do a trial situation. Once you've gotten out of your years of acute experience, and you think this is something you want to do, go in very honestly and say, I want to spend, 3 months or a month or even a few weeks going out with a home care nurse and seeing what it's like before I decide what I'm going to do. Even 2 weeks driving around with a home care nurse will give a nurse a good feeling of just how much is involved. Instead of being in one place, home care nurses are driving from one area to another area, especially in rural areas like ours. So they have to realize that they are going to be driving and sitting in their car at various times. And for some nurses, that's a great, gives them time to think, gives them time to, evaluate, gives them private time. So it's very positive. For other nurses that just want to park in the driveway and go to work in their hospital, it's not. I've seen home care go from where people thought it was just, people in little white hats that went out and did blood pressure and had tea and entertained people. And it turned out in 2000 that actually that's when things really started to change. And CMS, the Centers for Medicare and Medicaid in Washington, realized basically that home care was the future of nursing and it was the future of health care. But right now there's less than 10,000 agencies throughout the United States, and there's large groups of them in places like Los Angeles and San Francisco. Even here we have 4 or 5 in our small area. But the reality is there's a lot of places throughout this country that don't have home health agencies, and I think in the next 10 years we're going to see a doubling in that side, if not a tripling, because Medicare wants home care and they want community-based care. It's much more cost-effective and it's much more patient-friendly. Plus, it's what the patients want. We're going to have telehealth medicine, which is going to be able to monitor people at home really well. We're going to have chronic care, long-term care reimbursement, and the nurses that are going to be going into home care in the future are going to have the brightest future possible, because Medicare is going to, in the next few years, be paying for long-term care, chronic disease management, and also disease management overall. They've been doing trial tests throughout the United States now that have shown positively that disease management programs run by home care are much more effective than programs through the hospitals where they get a brochure and maybe a class.